Ever wondered why sometimes a seemingly minor health issue turns into an excruciating pain? Welcome to the world of piles, a condition that's more common than you might think. Today, we're going to delve into the nitty-gritty of this common but often misunderstood condition. Piles, also known as hemorrhoids, are swollen blood vessels in or around the anus and rectum. They can be either internal or external, and their size varies. Some are small, almost invisible, while others can grow large enough to protrude out of the anus. The primary reason behind the development of piles is increased pressure in the lower rectum. This can occur due to a variety of reasons such as prolonged sitting, pregnancy, obesity, chronic constipation or diarrhea, and lifting heavy weights regularly. Now let's talk about a slightly uncomfortable but important aspect, the bursting of piles. You might have heard about this, and it can indeed happen. When the walls of the blood vessels get too thin due to expansion, they can rupture, leading to bleeding. This is what is often referred to as piles bursting. When piles burst, it can result in a significant amount of bleeding. But don't panic just yet. Although it sounds scary, in most cases, the bleeding stops on its own. However, it's essential to seek medical help immediately to prevent complications and manage the condition effectively. Piles are usually diagnosed through a physical examination. In some cases, a doctor may also use additional tests like a colonoscopy or sigmoidoscopy to rule out other potential causes of bleeding. When it comes to treating piles, there are several options available. Mild cases often improve with dietary changes and over-the-counter remedies. Increasing fiber intake, staying hydrated, and regular exercise can significantly help manage the symptoms. However, in severe cases, where the piles have burst or are causing significant discomfort, medical treatments may be necessary. These can range from minimally invasive procedures like banding or sclerotherapy to more complex surgical procedures like a hemorrhoidectomy. Now, to summarize, piles are swollen blood vessels in or around the anus and rectum, caused primarily by increased pressure in the lower rectum. They can sometimes burst, leading to bleeding, but this usually stops on its own. Diagnosis is primarily through physical examination, and treatment ranges from lifestyle changes to surgery, based on the severity of the condition. Remember, if you ever experience symptoms like rectal bleeding, itching, discomfort, or a lump in the anal region, don't ignore them. Seek medical help immediately. Early diagnosis and treatment can significantly improve the quality of life and prevent complications. After all, health isn't just about living, it's about living well.